Okay, so before we talk about if these words could talk, there are some knowledge you might want to know about unwanted pregnancies. First of all, here are a few terminology that you may want to know. First one is zygote. It's from fertilization until second cell division. And embryo conceptus. It's between time of fertilization to 9 to 10 weeks of gestation. And how about fetus? It's from 9 to 19 weeks of gestation to time of birth. And infant, babies, time of birth to 1 year of age. So if we use developmental stages to divide up a pregnancy, and then there will be roughly 3 stages. The first one is from LMP to 12 weeks of embryo develops all the major organs, becomes a fetus, and the placenta takes over control. So from 12 weeks to 27 weeks, the fetus continues developing and reaches viability. So from 27 weeks on, the fetus finishes development and prepares for delivery. So when we talk about gestation, it's a mathematical method where it takes the 40-week gestation and divide it up by 3. Here, the second trimester begins at 13-week 3 day, and the third begins at 26-week and 6 day. And the conception, it's a mathematical method where you take the 38 weeks of post-conception development, divided by 3 and added 2 weeks. So here the second trimester begins at 14-week, 5 day, and third at 27 day. So if we talk about the survival rate, because normally if you want to talk about abortion thing, if you think about the survival rate, the 21 weeks or less, it's almost 0% survival rate. And the 22 weeks, 10%, 0 to 10%. 23 weeks, it's 10 to 35. And how about 24? It's a little bit more. Well, actually much more, 40 to 70%. And 25 weeks, it's 50 to 80. And 26, 80 to 90. If fetus reaches 27 weeks, the chance to survive is greater than 90%. So now, what is the viability? How many weeks? Well, think about it. Judging from what we have just talked about, the viability will be between 24 to 28 weeks. For your reference.